So now I invite Dr. Jaison. Everywhere I go, when he is there, I tell he is still the best cataract surgeon in India. Wherever I go, when I present, I tell Dr. JK, though I am from RP Center, Dr. JK Reddy is my teacher. This is another thing that I tell. Jaison will be speaking on trifocal IOLs.
Good morning. Good morning. I began implanting multifocal IOLs in early 2000 with array silicon refractive multifocal. Later I began implanting restore diffractive multifocals, but however, I could never fully accept multifocal IOLs because of due to the recurrent dissatisfaction expressed by some of my patients. This is one example. This patient underwent surgery for early cataracts. He had only a few cortical spokes. Although he achieved 6/6 and N6 both eyes, he still reported poor overall visual quality, along with issues of glare and halos. It was not the glare and halos that troubled him the most, rather the overall visual quality, which was poor. He felt that quality of vision after surgery has deteriorated, though he had a 6/6 and N6. So I went for an IOL exchange. The IOL explantation in the second eye was performed after 1 year. The refractive outcome was not very ideal. You can see I got myopia both eyes. However, patient said his vision was significantly better than before. I assumed that the patient dissatisfaction with the multifocal IOL was due to loss of contrast sensitivity. Meanwhile, the trifocal lenses were introduced. You know that they are a combination of two bifocal patterns. The first pattern has an addition of 3.5, which is the first diffractive order that is used for the near vision. You should know that the zero order is for distance. Therefore, the second diffraction order occurs at 7 diopters. So that 7 diopter is not used. It is the lost energy, and it is not used for the useful vision. So I think that is you know that 20% of light is lost in multifocal lenses. The second pattern's first order provides an addition of 1.75. So this is providing the intermediate vision. The second order is the bottom one. This is providing the intermediate vision. The second order has a divergence of 2 into 1.75, that is 3 diopter. So you can see that second diffraction order of the second pattern is reinforcing the first pattern's near vision. That 3.5 is added to the first pattern's 3.5. So approximately you gain 5% of light energy more in trifocals. So the percentage of lost light energy, which is 20% for standard diffractive bifocal IOL, is reduced to 15%. So I was convinced by this physics and physics behind trifocal lenses, and I adopted them immediately. Within few days, I implanted 12 trifocal lenses. And this was my 12th patient who also had early cataract. After surgery, he achieved 6/6 and N6 in that eye. However, he reported poor quality of vision, both near and distance. He was happy with intermediate vision. He said he was hesitant to undergo the surgery in the other eye, and he went back. A year later, he returned and had a unifocal lens implanted in the other eye. He was not ready for the multifocal or trifocal. He was satisfied with the outcome of the second eye and requested an IOL exchange in the first eye. This is another case. 50-year-old neurosurgeon wanted presbyopia LASIK. He was advised elsewhere that trifocal lens will be a better option, and he underwent trifocal lens in both eyes, achieving 6.6 and N6 both eyes. He said he can see objects at distance and near and intermediate ranges, but missing the object's finer details. This is the other eye of the patient. He has not returned to work since his surgery and has now been almost a year. He was taken up for IOL exchange, and IOL explantation was attempted at another facility earlier, but it was unsuccessful probably because of anterior capsular fibrosis and presence of plate haptics. To overcome the capsular rim fibrosis, you can see we have done radial cuts on the anterior capsule using YAG laser. So this is how it was explanted. Explanting, this is not an Indian IOL. I don't know which, it's I think Turkish or somewhere. So I could explant it because of that radial cut. The issue was extension of that radial cuts while manipulating. But I was lucky it didn't get extended, and I could explant that trifocal. I didn't divide the lens in the anterior chamber because I've never done it for a plate haptic lens. It was explanted and implanted a unifocal lens. I could place it in the bag. The second eye IOL exchange was done within few weeks. One day after residual myopia was targeted and achieved in second eye, patient was happy with the results. You know that clear lens extraction with multifocal or trifocal lens implantation for presbyopia has not gained widespread popularity. This is because these lenses causes loss of contrast sensitivity. Patients with early cataracts also may not tolerate multifocals and trifocals because of the same reason. These lenses tend to be better tolerated by patients with advanced cataract. My choice for presbyopia correction in cataract is EDOF lens or enhanced monofocals. Thank you.
Jaison, see these EDOF lenses. I mean, you all agree with me, right? He's the best. His hands and everything. Okay. See, the EDOF lenses still have that photic phenomena. Whatever. I mean, it's not that in these EDOF lenses, the photic phenomena of multifocal lenses are totally eliminated.
No. Actually, it is there. I'm implanting VVT and IHANS. The problems are there, but it is less. I feel you look at the lens, count the number of rings. If rings are more, it is going to create more issues. If it is directly proportional to the number of rings, that's what I feel. And if there are no rings, they are more problem.
Yeah, he is finished.
Yeah, it's over.
He is finished.
Thank you.
Okay. See, one second. Dr. Srikanth probably was the first person to use multifocal lenses in a big way. I believe he was using the Xeon rigid multifocal lenses, right? See, would you have continued because you didn't have much of a complaints with those lenses. If that was available, because somebody, one Sadish Shet is there, who does some things with, he has come out with a rigid IOL with these things. If that was available, would you still be using it?